So you're at 12 weeks now, right? And you're still having quite a bit of pain,
Correct.
right?
And I'm
In
at,
the
and that was
knee.
that one thing. 4 hours of sleep. That's it. I get 4 hours. I wake up. Maybe I can go back. Maybe not. 4 hours is that number.
Yeah. Okay. And then what do you do? Take pain medicine or ice or
I have it's actually me and my husband. We laugh because in the beginning we slept in the same bed. And then once that 7 weeks came, I became, like I say, a ninja warrior, my legs and kicking. And he's like, when you're sleeping, that thing is bent. And
huh,
so I'd wake up tired because it's like almost like I'm doing physical therapy in my sleep.
interesting.
And, I have sleep issues already because of the other health issues. So we have a system. I'll call him at like 3 o'clock in the morning and be like, honey, will you bring me ice pack, the doTERRA Deep Blue? I'm going to do a scar tissue massage.
Let's talk knees, titanium knees, from hurting to healing to taking the lead. Let's talk knees.
Christine,
Sounds good.
welcome to Total Knee Talk. We're so happy that you were able to come be on this channel with us and share your story. And with that, share your story. Tell us a little bit about you and what led you up to needing total knee replacement surgery.
First of all, I am so grateful I found you guys. I did so much research before the surgery, and all I found were like the physical therapy videos and, the actual goriness of what the video is, like what the knee replacement is, right? Like what they're going to do. But I didn't see many people's experiences after the fact. Like you've mentioned before in your videos, maybe one or two people that they're a week out or 2 weeks out, but not anything of length. So a little back part, and I think I've emailed you guys about this. I have a lot of chronic health issues. I stopped working 14 years ago. And so I have fibromyalgia. I have a connectivity genetic disorder called EDS, Ehlers-Danlos syndrome. The best way to explain that is my connectivity tissue is more like bubblegum than other people that's like Gorilla Glue. So throughout my life, I've sprained ankles, broken foot, wrist. I mean, we travel and we go on vacation with braces. And I never knew what it was till a couple of years ago. I got diagnosed with EDS.
Wow.
My sister has it. She got diagnosed several years ago and had bugged me to get diagnosed because she's like, you have it. My niece has it, and we can go through. My sister has done so much research that she can look at generations of people that have it. We tend to have longer limbs. Some people that know about EDS know about stretchy skin, or like you can do weird things with your hands. And like, my sister, when she was younger, could take her kneecap and put it behind her kneecap.
Oh,
Just like
shut
weird.
up.
It's just a really, I know. It's an odd disorder a lot of people don't know about.
Wow.
So
it's a genetic thing.
it's a genetic thing.
Okay.
Correct.
Okay.
And then, as I said, I have the fibromyalgia, I have neuropathy, non-diabetic at my hands. And I just have this like slew of autoimmune stuff, right? So to get to the knee part, but that part is really important. Oh, and one other thing, I had gastric bypass, which I shouldn't have done had we known I had EDS. Because basically that connectivity tissue is around our organs, it's around everything. Yeah. And so I heal differently. I'm highly allergic to adhesives. I bruise easily. When they do lab work, I have issues. And I've had 22 surgeries in my life, not procedures, like actual, there's a body part you don't need. I don't have it. That's the best way to explain it. But so we knew that a knee replacement was going to be a big deal. But to give you the backstory, I was 25 years old, so many moons ago, and I had a bad accident at work. And long story short, I had on my left knee is what I injured, dislocated the kneecap, and I had 3 surgeries on that. And I had to have 2 surgeries on my right knee because I overcompensated for over 2 years. 5 surgeries, immobilizers, ankle to hip, the whole 9. And, same thing. We didn't know. I never heal well from surgery. I do really great under anesthesia. Surgery goes well, typically complications a week to 2 weeks out.
Wow.
Never knew it. Even with the gastric bypass, I had major complications 3 weeks out, and I'm 20 years out from that surgery. And so we knew, I always was told I would need a knee replacement at some point in my life. And the magic number was 50. Don't even think about it till you're 50. And I'm 53. And so I had done, gosh, maybe 15 years ago, I did the gel injections when they were still like experimental. I think there's two people that really stuck out that you've already interviewed for me is Vance and Marianne. I related to a lot of different things on both of them. But anyway, I had the knee and I had, those injections that it improved, right? Through the years, it got a little better. And when you're dealing with other chronic health issues, you kind of pick what's the worst at the time, right? And I think that was one of the things that with your videos is seeing that healthy people have problems with knee replacement, more or less someone that lives with chronic health issues. It puts a different whole mixture in it. So to get me to the point to want the knee replacement finally, doctors always had told me it would be my choice. So like, I didn't realize it was an elective surgery till you mentioned it, but it just told me, all the doctors would say to me, and I've seen a lot of orthopedics through the years, have told me that you'll know when you know. And I did this amazing vacation with a girlfriend, kind of like some community work. We went to Cuba and the infrastructure is different, lots of walking, these real narrow stairwells, no AC. And I came back and I couldn't walk for like 3 months. Wow. I mean, and then I got thrown into what's called a fibromyalgia flare-up, a fibro flare-up. I don't know if you guys are familiar with fibromyalgia. Either people know about it or they don't. And so I was down for the count. And I told my husband, I don't know if I'll ever be able to vacation again like that. We love to walk and, exercise. We joke, we live in South Georgia now, and we're on the Florida-Georgia line. So my husband always says we live in Florida. So when we say hike here, we're walking in a state park.
Right.
But we did the big hikes back in the day in North Georgia when we lived up there, like at Amicalola and like the Blue Ridge Mountains and stuff. And I just got to the point I couldn't do it anymore. And I was like, okay, I'm ready. Well, I had been doing cortisone shots when I needed them. And I went to go get a cortisone shot and my doctor retired and I didn't know. And we live in a small town. Valdosta is a very small town. And I was like, okay. And we were getting ready to talk about a knee replacement. And he literally like retired in November and I went in December to go find out. So then I had to start the process over. I did some research. There's like three orthopedic practices in our town, and everyone recommended this practice and one specific doctor. Well, because that other doctor retired, everybody was going to this one doctor. So I asked if there was anybody else in the practice, and then basically because of insurance and things, we just couldn't jump right into surgery. We had to do all the things.
Right.
And so we did, cortisone shots. And I love how you talk about like, they're not healthy for us. We shouldn't be doing all these cortisone shots. And it's like a quick fix. And then it's not a quick fix. It doesn't work anymore. And
but most people can't move forward and have surgery because insurance says you have to do cortisone shots first.
Without a doubt. Yeah. Yes. And so the process started in January. And I got a cortisone shot, and then I went again in 3 months. And every once in a while I'll get one on the right because I do have problems with my right. And they've talked knee replacement on that. Right now I'm like, over my dead body, are we doing a knee replacement on the right? So we did the cortisone, and there's a timeline with this. We did the cortisone in January. And then I went back like 3 months later when you can, give or take. And we were going on a cruise for our anniversary in May. And I needed the shot. And they were like, no, you got to wait like 2 more weeks. You're not in that time. And I'm like, please, just please. And it was like, I think we were like a week shy and they did it. And we went on the cruise and we only got off there were 2 ports, but we only got off at 1. I'm like, I can't do it. And my husband, I joke, we never thought we'd become cruisers. And I said, with my health, that's like the only thing I feel like I can do.
Yeah.
I can't walk
Right.
without being miserable.
Right.
And then add on the other health issues. So that's the short version, I guess. Because there's a lot of different dynamics in my journey.
Uh-huh. Okay. So then you had surgery 12 weeks ago, right?
I had surgery 12 weeks ago.
12 weeks ago.
So when I got back, I was still miserable in pain. I went to my orthopedic. And this is really important too. With my orthopedic, I interview my doctors. When you have chronic health issues, you really have to be your own advocate. It's huge. And we've lived in Valdosta for 7 years, and I finally feel like I have a solid medical team.
Good.
It took me that long
Wow.
to really find all the players. When, we lived up in Atlanta, it's really easy when you're in a big city, right? And my question the first time I saw him, and now I've learned this just because I was diagnosed in the last few years, is, do you know what EDS is? And he's like, absolutely. And because we're treated differently, we're handled differently because of the way our bodies are. So fast forward, we go in, we're talking about, we're ready for surgery. This is like, we need to do this. He gave me so I would say maybe July of this year. And he said, with your EDS, your recovery is going to take 3 to 6 months longer than the average person. Absolutely. So I know this is going to be a 2-year process, right? Give or take.
Mm-hmm.
But my quality of life was gone. And he said to me, the particular insurance I had, he's like, they're going to fight us. He's like, because we did the X-ray and you really couldn't see a lot. But when you did the MRI, it was bone on bone. But he's like, they're really going to fight you. So he's like, so be prepared. We're going to get denied, but we'll keep fighting it. And he said, but I want you to start physical therapy. And I said, okay. And because of my health issues, I do a lot of exercises every day to just function and get out of bed. Like, just to get me moving.
Mm-hmm.
And so I did the protocol. I went to PT, and I really related to you when you said it. Like, I went to PT. The lady was nice enough. Same thing. Do you know what EDS is? Kind of scratched her head. There was a student there, and she's like, well, I know what it is. She was like an intern, because it's, obviously further down the road, kids are in school, they're learning different new technologies, new weird diagnoses. And she said, well, yeah, I kind of do. And then the next time I went, I could tell she had researched it a little more. But in all honesty, I just didn't feel like I connected with her. And I've learned a long time ago, it's okay to fire a doctor or whoever. And it's not rude now, to fast forward, she helps with the person that I'm using in PT, and I love her to death. It's just, we weren't a good connection.
Mm-hmm.
And, and then we had decided after either 2 or 3 visits, she's like, you do these exercises already. She's like, you do more than what I'm asking you to do to live your normal life. And I call it by the grace of God, I got approved right away.
Wow.
And it was, I don't know if it's because of all my other health issues or because of the amount of documentations. I see a file that's this big and it's like, well, we're going to have to do it anyway. Let's just do it, And so we scheduled for September the 2nd. Everything was going great, normal, surgery set up, the talk with the anesthesiologist. How do you do under anesthesia? Great. You need to give me more than the average person. I have EDS. Okay, I'm aware of that. Because we don't stay under anesthesia. I don't know if it's as long as other people, but like everybody from an orthopedic to a dentist, we have to tell EDS. Like it's a different whole beast.
Yeah.
And so he's like, yeah, I'm fully aware. You go over all the allergies. On my allergies, it lists I'm allergic to adhesives. I'm allergic to latex. And I found out I was allergic to latex 16 years ago by accident, because I had gastric bypass, and years later I had a tummy tuck, and I became extremely, it was horrible reaction to latex.
Right.
So I knew that already, that surgeries, I do really, you got to be very careful with that stuff. So I talked about it with them. Fast forward, come out of the surgery, everything's great. I'm moving. I mean, they didn't make me go to the bathroom, which I hear that everyone says that, but you have to go to the bathroom before you can leave. I didn't have to do any of that. I just had to walk from
Really?
point A to point B. Yeah. I mean, I've heard everybody say it, but unless I don't remember, but my husband's like, I don't think they did. Like, so,
Interesting.
yeah, I was there. Maybe it was a surgical center. Our doctor has a surgical center in his office. It's a pretty big practice. They have several locations throughout Georgia. And so, I mean, we got there 5 a.m. I want to say we were home by lunchtime, give or take. And everything was going great until it wasn't. And when you have chronic health issues, you have to learn how to listen to your body. And at day 4, I felt my bandage getting itchy. And I'm like, oh, God. And I looked down and I'm like, that's an adhesive.
Oh, no.
Granted, you have all these drugs in you. And, I didn't want to take the pain medicine. I don't do a lot of pain medications. I do a lot of alternative treatments because of the absorption issues from the gastric bypass. And my doctor's like, you have to take these the first 4 days or you will be miserable. And I don't know if the nerve block was coming off, all the things. And I pulled the bandage just a little bit and it was bubbling. And so my surgery was on Tuesday. That was Saturday. I was like, all right, maybe I can hold out till Monday. Sunday, I was in excruciating pain. And I called the surgeon. And, he said, oh, that happens sometimes. I said, no, I'm really allergic to adhesives. Like, oh, even people that aren't allergic to adhesive, it happens sometimes. Like, I had ripped off the bandage and I saw what my leg was looking like. And so he called in, something like he told me to take Benadryl and some sort of other prescription, like a hydrococ. I can't think of the word, but like it starts with an H, but it was some sort of medication that would help with this allergy. And so that evening I get a text from the girl that's going to be doing PT in home because we decided to start with in-home PT. And I'll be honest, it's because I didn't feel warm and fuzzy about the PT I received at the location beforehand.
Mm-hmm.
And I'm like, if I do it in home, it's free. And if I do it there, I got to pay.
Right.
And I didn't feel warm and fuzzy. Well, an advantage we have is my 88-year-old father-in-law lives with us and he gets home health care that comes once a week.
Oh.
And it was that same organization he's been seeing for a couple of years. So I said to the young lady who was my godsend, oh my God, Kaylee, I give so much to her and help in my journey, the PT assistant. I sent her the picture and I said, well, I don't know how we're going to do PT with this. And she said, we need to get you an in-home nurse. So Monday, she came for PT and an in-home nurse came in. They called the doctor because when I talked to the doctor, they were like, no, you don't have to come in. They did prescribe me an antibiotic because I felt like I was starting to look infected. So that Monday, so I'm not even a full week or 6 days in, I've got blisters the size of quarters. I think I sent you the pictures.
You did, and I wanted to ask, are you okay with us inserting them in and letting everyone see?
1000%.
Okay, good.
Word of warning for the next part of the interview. We're going to talk about her allergic reaction to the adhesives in this, and there are some graphic photos. So
be warned.
Yeah. Don't leave.
Close one eye,
right,
and cover the other one. Because that's how I looked at him.
The doctor, and his nurse, who are amazing. I have a phenomenal relationship with all of them now. Wasn't there? I didn't feel warm and fuzzy at some points, but I really have a phenomenal relationship, and I'm so pleased with the medical team I have. But blisters the size of quarters are all around, like that big bandage is like a rectangle.
Right.
And then when I took that bandage off, I didn't put, you're still kind of out of it, right? All those steri strips are adhesives. So when the nurse came, she pulled them and every steri strip had a blister. So then she's like, oh, this is not acceptable. And she got on FaceTime with my doctor's nurse. And then everybody was like shocked. In this 12 weeks, anybody and everybody who will look at pictures, I show them in the medical profession, and maybe some of my friends that don't want to see it. And no one has ever seen such a severe reaction, ever. And the problem is that so many people are allergic to things, right? You get some blood, you keep the Band-Aid on too much, it's red, right?
Right.
Or you have an EKG and you have all these stickers and you get off and it's irritated for a
Right.
few days. And so I had deja vu of 16 years ago having a tummy tuck and the pain being ridiculous. So I had a home health care nurse come in 3 times a week for 5 weeks. PT was coming in 3 times a week. But there were 2 major things that everybody said that were integral. The most important thing you do after knee replacement: ice and PT. And you can't ice blisters.
Mm.
And you got to be careful with movement because you can
Sure.
pop the blister.
Sure.
So, yeah. And one thing that's truly why I wanted to do this is the one thing I think, besides the icing the back of my knee, that I've got from almost everybody you talk to is the emotional piece, the sense of defeat. I am not a crier. I have cried more in the last 3 months than I have in the last 30 years.
Mm.
And it has been so hard. My husband is still very actively my caretaker. We are blessed because he was semi-retired, and the timing, maybe a month into this, he had the opportunity to fully retire. Now, granted, we have his 88-year-old father too living
Right.
with us, and I was helping a lot with there. I don't know what I would have done. I don't know what I would do without him. Like, I mean, my accomplishments these days are I can take a shower and stand up for 5 minutes before I have to get into the chair. So, the movement, the PT was coming. We were, fast. I didn't stop me if I'm going too fast, or I'm a northerner originally. I talk fast. I talk a lot.
We're in
But
it. We're in it there.
okay, and I know I have a lot of information to squeeze in a time, and but also in those 7 weeks, I was what is called the fibro flare-up in the fibromyalgia community, we call them. I never had pain from this surgery until 7 weeks. I did not feel like I had a knee replacement till 7 weeks because basically they were like second-degree burns,
Yeah.
like on my knee. So
Yeah.
the pain from that, and with fibromyalgia, you have all over widespread body pain.
Mm-hmm.
And so I was in this flare up, and we say basically in this area, it's hurricane season. My worst time of year is from May, June to like September, October, give or take. So I even said to my husband today, I said, if I was to do the next one, we got to wait another month. Let's be totally out of hurricane
Right.
season.
For sure.
But and I couldn't do the things that helped me with that because like I'm not on the medications people take for fibromyalgia. So I'm a Epsom salt bath person 2 to 3 times a day.
Wow.
I don't know when I'm ever going to be able to soak in a tub again. I mean, I feel like it's never. And I do acupuncture every 2 weeks, which is a huge part of my journey. And I couldn't do that.
Wow.
So when I finally did acupuncture, when I could get to that point, that flare up went away. And then it was, okay, oh, wow, my body, this hurts. I had a knee replacement. That was at 7 weeks out.
Interesting. That's so
So-
interesting.
The smacks just keep coming.
Oh my gosh. And I put it on Facebook, I want to say about 3 weeks into it, maybe 2 weeks in. And I'm a very transparent person. I'm a believer that if one person gets something from my journey, then it's all worth it, right? To share that you're not alone, right? That
Right.
other people are going through this. So it's not uncommon for me to share the good, the bad, the ugly, whatever it is in life. I'm just that person. And the response from people that like I haven't talked to in decades, like, you need to sue, you need to do this. And I mean, so many people saying that. But my heart was like, suing is not going to do anything. And then I really had to reflect, did anybody maliciously do something to hurt me? You know, we're human. You know, I don't know who put that bandage on. And I had a breakdown at 7 week, right before my 7 week follow-up with a dear friend, hysterical. And she said, you are the first person to tell someone advocate for your health. Do you want to fire your doctor? Do you want to keep your doctor? What do you want to do in your journey? And it really made me dig deep down of how do I want to handle this, right?
Mm-hmm.
And you see, even probably with different people you interview, some people are positive about it, some people are negative.
Mm-hmm.
It's a lot of it's mindset. And I mean, I'm a Christian, and I'll give God a lot of credit. That's just who I am. I mean, and I did a lot of praying. And that week was really emotional. Before that was Sunday, I had that conversation. On Friday was my post-op, and really struggling of what is the solution to this. So, you know, and I found one guy, some videos after I found you. I think his name's Russ is Right, or Right with Russ or something. And his journey, he's had a ton of complications. His knee replacement was like 5 or 6 years ago, but I don't know if you've seen his videos.
I don't
But
think so.
yeah, I'll have to I email it to you, because I got so much great information from him, and he had a lot of problems with bending and things. And at 7 weeks with PT coming religiously, we got to 75 twice, but most of the time it was like 60, 65. And my extension, we did get it to 0. So trying to figure out how I'm going to handle this. When you have an invisible illness, it's really hard for people to know how you feel, because you wear all these masks, right? Like, you don't want to be that negative. Like, someone asks you how you're doing, it's like, oh, you do not even really want to know. So you know, and even being transparent, I'm still careful with that. And so I went to my visit. It was my post-op of how I was going to handle this with this surgeon, who I respect tremendously. He did what he's supposed to do. My scar is gorgeous. The cut was perfect. You know, I feel like the kneecap feels good in there. But this was my second post-op, because I went after a week and everything was really raw, because I'm still dealing with the allergic reaction. And the X-ray technician tried to get my X-ray, and she couldn't get it. I mean, they needed 4 images, I believe. She could only get 2, and I just bawl and hysterical. I mean, hysterical, and just, I'm showing her my phone and the picture. And I said, I show everybody those pictures, because I want people to realize at that time, I blamed everything 100% on, they used adhesive. You know, I didn't get to jump into PT. I didn't get to ice. That's where my mindset was. So I go into the waiting room. Into the, you know, the room to see the doctor. My husband's in there, and I'm a hot mess, and he's not even you. I mean, that's just not who I am. And so the doctor comes in, and he sees me vulnerable, obvious. And we had the most amazing, candid conversation. Just, I was able to express my concerns, and he was able to come back to me and explain what their issues are. Like, they used glue, and then he's like, we have to protect this and seal it. And he's like, and keep it waterproof. And I'm like, wait, that was waterproof? I've been putting this big contraption I bought on Amazon every time I shower, you know? And I didn't even know that, you know? And he's like, you know, I said, I know paper tape works on me. I honestly usually always tell them that. And I don't remember, to be honest. I don't know if I told them use paper tape or not, but paper tape's an adhesive too, right?
Yeah.
So, but I know my body. So, you know, we went back and forth. I told him, like, you know, when I have an IV and they put that clear, you know, it's called Thera something. And I said, I don't have a reaction to that. And I said, you know, typically no reaction to paper tape. And he then expressed to me his issues, that, you know, people say they have an allergic reaction to adhesive, and like that whole Band-Aid EKG type thing, like, you know, you get a little red bump, or if you wear a Band-Aid a few days or whatever. So we got to really communicate, and it opened our relationship. We're phenomenal now. Like, I'd already started to build a relationship with his nurse. And so the option at that point was, let's do an MUA. Can I tell you, I've heard you talk about it. I've been through a lot. I live with chronic pain. I woke up from that crying. If anybody can avoid that, if there's anything you can avoid, and I don't say it to scare people. I mean, I've been through it with health issues, and I've never had children, so I don't know, maybe that's worse. I mean, basically what they do is and okay, so let me back up a minute before I tell you about the details of that. I'm going back to the same surgical place. So we talked candidly. He's like, there's no bandages. If we put you on anything, it's an ACE bandage. But when I say everybody talked about this, they knew who I was coming in, because there were so many questions, and they were setting, it took them 5 times to get an IV in me. The anesthesiologist had to do it. I had a bruise on my arm literally for 3 weeks. Like, it just went away from IV. I felt so bad for the nurse in there. She tried so hard, and I'm like, no, it's me, it's not you. And I do give people a lot of grace with those things, because we're human, and my body is different than other people, and I know that. And one of the girls came out and said, can we take your phone? I'm like, sure. Literally, I would say 20 people saw that. And they were blown away with how bad the allergic reaction was. And then they were excited how good the scar looked. And they're like, what did you do? And I'm like, oh, I'm into essential oils. And they're like, you should be bottling and selling that. I mean, because I mean, if you look at those 2 pictures, like, that was only, 8-9 weeks away from each other. It doesn't even look like I have a scar at this point.
Wow.
And the anesthesiologist, I believe, is the one who said it. This is all a great learning experience for all of us. Like, and I had a woman, one of the nurses, I think she was part of, actually, like, they came out of the surgical area to come to me and talk to me before I even went back. And she said, I think she said she's been a nurse 20, 25 years. She said, I need you to do me a favor, put on your file that you go into anaphylactic shock if they use adhesives.
Wow.
And then people will take
That's
you
good.
serious. And I'm like, okay,
That's good.
never thought about it, but I mean, maybe.
'Cause
So,
that'll get their attention.
and that's exactly what she said, because I mean, as I said, the doctor told me, I saw him on Monday, and he said he's had one patient that's had some sort of a reaction, but nothing as severe as mine. I mean, and like, everybody that was coming from home health care, like, I don't know how many people have seen floated this picture around just in shock of that reaction. So the MUA is, as you are aware of, but for people that don't, it's it's a manipulation under anesthesia. So they even gave me extra. The anesthesiologist was concerned, so I got the nerve block, all that. We gave extra anesthesia, anything they could do to, like, make sure I didn't hear it, because what the doctor explained to me is that they put you on anesthesia, he puts all his body weight into it, and they wait for that magic moment where it's super quiet and they hear. And I'm like, oh, that sounds exciting. Now, this is important, because up until this point, I had blamed everything on the allergic reaction. I couldn't move it the way I couldn't ice. There was an integral part that my husband forgot to tell me, and that surgeon had talked about, was because of all those other surgeries, I had a tremendous amount of scar tissue. And so, hindsight, even if that whole allergic reaction didn't happen, I probably would have needed an MUA, because the scar tissue was so bad. And basically, then you build scar tissue as soon as they close you up.
Right.
And the videos I've watched of, even there's one physical therapist I watch all the time, and he talks about it's like it heals from the inside out.
Mm-hmm.
And so that scar tissue can develop really quickly.
Mm-hmm.
And one of the things with EDS is we tend to heal pretty quickly in that respect. So my body, we don't know if it's all from what, so I wake up crying. My husband tells me they got me at 95. Primarily, he kind of was close to 100. He didn't want to push it any further. My husband said he seemed kind of frustrated, like defeated a little bit, because the goal was 110, 120.
Wow.
And I was the closest to that. I was probably at like a solid 70. So I had to promise him I would do and this is important too. I had to promise him that I would come in person and do PT, because you have to be after an MUA. It's very, very important to be aggressive.
Yeah.
And I said, okay, I'll do that. And I picked up the phone and I called his nurse and said, let me tell you why I didn't do PT with you guys to begin with. And I said, it's no disrespect to this person at all. As I said, she's kind of assists sometimes with my current physical therapist. But I said, I need someone who truly understands what EDS is or is willing to do the research. And she said they had a young lady who's a recent grad who is working on another patient who had been working on a patient who actually had an MUA the same day as me. And she really understands how the MUAs work, and she knows what EDS is. And Logan has been a gift. Oh my God, Logan has been such a gift. And so that was really important, being my own advocate. Like, I will do this if we do X, Y, Z. Another thing I had heard about was a CDM machine, which there's a lot of mixed reviews on that. Luckily my insurance covers it. I had a cousin who had this like 10 years ago. She had 2 knee replacements. I think it's like 10 years ago. And she like could not believe that they did not put me on a CDM machine. And I had talked to the supervisor that came in. When you have home health care, you'd have different levels of people come in, of PT. And she said they just don't really use them. But when I talked to my doctor's nurse, she said, under your situation, I think it would be a good idea. So I have a CDM machine. I've stopped using it. That's another, we'll get to that. But so just doing all the things to be proactive. The pain is still like, if anybody could get away with not getting an MUA, like do all the things from the get-go. And that's what scares me a little bit on some of the people early on that are like, oh, I'm doing great, I'm doing fine. I'm like, or you hear of people not doing their PT or their exercises. It's like, this is a life. Like, if I want to still be able to hike and do things, like I can't just do this. I mean, with my chronic health issues, but even a normal person, you got to keep doing it. Like, because otherwise you're going to
for the rest of your life. Yeah.
Yes.
I mean, I noticed that, I do less on the weekends. I figure I need a little break, so I do a little bit less on the weekend. And I can tell you, I start feeling and, I'll start having like maybe some pain and just some discomfort and stuff, and it's like, I can't wait to just do my PT again and just work out, I mean, it's just important. And you're right. Too many people think when they're released from PT that they can just go sit in their recliner and do whatever. And not after this, not after total knee. This has to be part of your life for the rest of your life. Mm-hmm. So tell me, where are you at now, range of motion wise, after that MUA?
So yesterday was an exciting day. Like, when I say I want to scream off the top of the roof, because I got out of the MUA, the first day I went to PT, I was only 70. So I went from 90 in a day, less than 12 hours, went from 95 way back to 70. I was at 87 yesterday.
Good.
And I had been like, we've been stuck at 81. Now something else happened when I saw him on Monday. He put me on a steroid, which comes with another whole beast of stuff. So that was something we think was helpful. I'm supposed to do this 3 times a week, go in person. We took Wednesday off. I saw my acupuncturist on Thursday, back to seeing my acupuncturist. I know how to handle my body with my chronic health issues, and throwing this in. It's like a full-time job taking care of your knee replacement. Mm-hmm. But my other health stuff did not go away. And so I had to really shift my mindset, and really be like, I'm in this. Like, this is all not going to be for nothing. Because the reason I had the knee replacement is because that's something normal, like that I can get rid of
Right.
versus all the other stuff.
Right.
So yesterday we got at 87. I got to 86 by myself, but with a little push, she got me to 87. And my extension is at 3. Now, there's a frustration on the extension because before the MUA, I was at 0 and I went to 6, but that could be part of the EDS. There's just so many weird little things that have added to it. So I feel great. Like, I feel like I conquered. I was just like on cloud 9 all day yesterday because I don't know. It just felt like a huge accomplishment. I think I was a little anxious about today because this is really important to me to get my story out there.
Sure.
And thank you guys, like, because I tried the Facebook groups, and I'm in a lot of Facebook groups for different things, and some of it makes it worse and toxic. And
Yeah.
your authenticity and organically and your vulnerability, I really wanted to be a part of what you're doing because people need to hear. I heard of this is like this, you hear, oh, I should have done it 10 years ago, or a 70-something-year-old has it and they're on the golf course.
Right.
Or another friend, her husband had it 2 weeks after me, and he's with the leaf blower and he's in his late 60s. And I'm like, are you kidding? I know I'm different. I get that, but I'm 75% the walker, 20% the cane, 5% walking on my own, which I don't think my physical therapist is thrilled about because the fall risk, like,
Sure. Sure. Are you able to bear all your weight or, equal weight on both legs? Can you put weight
not
on
at
that
all.
knee? No.
No.
Because you have
The pain
pain
is
if you do?
Yeah, the pain is excruciating. And I don't take anything.
Okay.
I shouldn't say anything. At this point, I am willing to take a pain pill before I go to PT. The problem is it tears up my stomach and I get very, very ill from it.
Yeah.
So it's a trade-off. But I know I need, and as my husband always says to me, this is temporary. This is temporary. Your temporary might be 2 years, but this is temporary. And so I will it took me a while to get to that point. Probably only in the last 3 weeks, I started doing that. I do take children's liquid Tylenol. In order to absorb medication, usually liquid is the key.
Gotcha.
Or IVs. I do wonderful with IVs, honestly. I always feel like I sleep the best, I get medicated the best, I don't feel pain. And then I'm really into doTERRA essential oils. And I have, if you know about oils, doTERRA and Young Living, you can consume them.
Right.
And so I make these little veggie caps, and it's like frankincense and oregano, and believe it or not, they call it a morphine bomb. It helps my pain. But when you live with chronic pain, it's just a way of life. I stopped working 14 years ago.
So do you feel like the pain that you're experiencing at 12 weeks in your knee, like when you put weight on it and stuff, is that just all because I've had a total knee replacement? Or do you feel like that a lot of that is because of the EDS, that you're still having pain at 12 weeks?
So I think it is because of the knee replacement, where the pain is coming from. But the EDS affects me because I remember when I sat with him at that 7 week when we decided to have the MUA, I slapped my thigh and said, well, what are we going to do about this? And he's like, I can't do anything. That's EDS. So my quad and my calf are so weak right now. And even trying to do where, you take a towel and press it down, the physical therapy where you push it down. I physically can't do that. So that's me going in person to PT. I do 5 minutes on the bike. We do a couple exercises, but I would say 75% is my physical therapist putting all her body into it.
Wow.
And so the pain definitely is the knee replacement, but I think it's more the MUA, honestly. And so when I did see him, he did say to me, he felt if he went any further, he would break my femur.
Okay, and so
And
my next question was gonna be, has there been an MRI or an X-ray since you had the MUA to make sure that nothing's broken in there?
no, we have not done that. No, no, actually, let me think. Did
Because I
we?
did hear from
No, we
someone
did,
who
we did. Yeah, we
okay,
did.
and
Because
everything's
I
okay.
couldn't do the X-ray before the MUA. And so when I saw him this Monday, we were able to do it because that was my fear is hope we can get that. No, it looks the knee replacement looks beautiful.
Good.
Everything looks great. So my PT and just talking to different people and some other that one, as I said, well, you got to check out that one guy. I think it's like Keeping It Real with Russ
Yeah, I'll
or
look for
Russ
him.
is Right. He has a really interesting. I mean, he physical therapists have interviewed him, but he had a second MUA, and we kind of thought maybe that's what was going to happen. And the doctor said he felt like he didn't think it was worth it to do it. So I think the goal really is to get to like 100. I think everybody would be happy at 100.
Yeah.
Which is kind of crazy because with the EDS, where I have what's called hypermobility. I always say it wrong. Yeah, hypermobility. So I'm actually, my kneecap is usually even lower, and my bend, like on my right knee, is like ridiculous, like 140, you know? So, yeah, so the MUA was not an option. The next option is another surgery, but we're not going to even look at that till 3 months because the scar tissue is so bad. So this is where I think it's really important for people to hear about our mindset, because the emotional piece has been so rough on me, and I had to get out of that defeated piece, which people who know me are very surprised I even got in that space. But I had to be like, no, I'm giving it all. But there was one video you did, it was one of your first videos, and you said Dee had to rein you in because it's like, I'm going to give it my all. I'm going to do it. Well, we realized just from the events this week, taking a day off, giving my body some rest, have all these other health issues. Between physical therapy 3 times a week, I was supposed to be on the CDM machine 3 hours a day, do my exercises. It's a full-time job.
It is.
And so we decided we're going to try it this week because it's a holiday week. We're going to try 2 days on, 3 days. I mean, 2 days one week, 3 days another week. But my thought was, I'm going to go into this gung ho. Let's get her done. So I got to find that happy medium, but I think I'm there. I think.
Good. And it also sounds like maybe with the EDS, where you're at 12 weeks might be for someone else, maybe that's their 6 weeks,
Yeah.
because it kind of sets you back a little bit, it sounds like. I mean, it sounds like you definitely know your body better than anybody and know how to deal with it and what to do for it. And I'm so sorry that you have to deal with all this. And especially, I just always hate hearing, that someone is, months out and still having pain. But, knowing the EDS and everything else that you're dealing with, you know, like your husband says, this is temporary, even though 2 years of temporary is a long time. But, I guess, at this point when we're in it, all we can do is look forward to, getting on the other side of it. And for some, it takes longer to get to that other side, unfortunately. But I do love your positivity. I love your outlook. I mean, that's definitely very inspiring. So
Well, my thing with this is I was really hoping, obviously, just to help the average person, but I think the thing that I was searching for and I could not find, which is kind of uncommon for like groups and stuff, is I couldn't find anyone with chronic health issues talking very openly about a knee replacement.
Right.
I couldn't find somebody. I'm not even taking the EDS because the EDS is genetics, it's more complicated, but like fibromyalgia is pretty common.
Sure.
I couldn't find, people that had invisible, all these autoimmune. I couldn't find anybody out there. More or less, I found you through an RV site.
Yeah.
I mean, it was just kind of like, because I would just put all these different words and I didn't comment. It's kind of funny because I didn't really realize that on anything because I watch it on TV. So, I mean, I always but I never
We do the same
commented.
thing. Yeah, we do the same
I
thing.
feel, and I didn't think to look through the comments literally until like a week ago. And I just really loved how you just like were so raw. And I just think that there needs to be, I have a few people in my life that are like, you tell everybody, like I have someone in my life that's like, why call you? It's on Facebook. And I'm like, but if that journey is helping somebody,
Right.
I don't know. It's just really important to me for people not to know they're alone. I've been given this body for a reason. And I can see a lot of good that even came out of that allergic reaction. I
Yeah.
can look back now and go, this I'm friends on Facebook with my physical therapist assistant, and yesterday she saw my post and she's like, I'm so proud of you, and I just feel like we can touch other people through the
Sure.
negativity, you
Sure. And
know?
I just think it's important to just be real and to just
Amen.
put it out there the way that it is. I mean, why sugarcoat it? And and there are plenty of knee videos out there that from somebody that's had knee replacement and they're talking about how 3 weeks later I drove to the post office and
Yeah.
and it wasn't that bad and everything, and I'm like, you're the minute
1%.
yes, you're the minority. I think for most people it's tough. It's a tough recovery, and I just have always felt like it's okay to let people know that this is tough, and that's what we want to do. And my hope for you and for this video is that people who deal with fibromyalgia and deal with other chronic illnesses and autoimmune illnesses will comment on this video and reach out to you, and because I
I'd
I,
love
I really
that.
think that your story can help a lot of
Yeah.
people, because I guarantee you're not the only one that maybe has fibromyalgia and had to have a knee replacement, and probably those other people are like, well, nobody ever talks about the fibromyalgia and how that affected
Yeah.
it, and so I think your story is going to really help a lot of people, and we're so glad that you were willing to share it and be very transparent, because it's just very helpful and it really means a lot, and I know it's going to help a lot of people out there, so we really
Well,
appreciate
what's
that.
interesting is I started writing the email to you and I would put it together and then I would do it as a draft. And it literally took me 3 weeks because I kept having more layers onto my story.
Yeah.
And like, even when you said, well, let's wait till the MUA. And then we had talked about doing this last week. And I'm like, wait, I got a doctor's appointment on Monday. Let's see what happens
Yeah.
there.
Yeah.
And, it's just, I knew that I wanted this out there, but people said, oh, you should do a YouTube channel. Well, I don't have the health to maintain it,
Sure. Sure.
and that's what's hard because people see this. Well, I will nap and relax and do nothing probably the rest of the weekends, and
Mhm.
I love when you even said that you rest your body on the weekends, because what was happening to me is I would do everything I was supposed to Monday, Wednesday, Friday, and I learned the pattern that if I have PT, I don't sleep that next night. So I
Yeah.
didn't sleep last night because I had PT.
Yeah.
I learned that if I did all those things Monday through Friday, come the weekend, I was dead. I think I slept one day 14 hours. And that's
Yeah.
not good for the fibromyalgia, And another thing is I get up a lot. So to be like, I know we're supposed to, with the knee surgery, tell you get up a lot. I need to get up a lot.
Yeah.
And
Yeah.
it's hard when you feel like you're carrying 20,000 pounds,
Yeah.
But when you talked about the drive you did, that really resonated with me because I tried to drive twice before the MUA and I didn't feel safe
Yeah.
because and so I have started driving only in the last week or so. And I'm very conscientious. I only drive on days I don't have PT. So I know there's nothing in my system. And I only drive to the grocery store, which is 10 minutes away, not
Mhm.
even. And I use a little motor cart, but even keeping the leg extended in that is uncomfortable.
Mhm.
Sitting in a regular chair is very uncomfortable. My husband took me out. My birthday was in the mix of all this and want to take me to Olive Garden. We need to make it past salad. I'm like, we're out of here.
Uh,
I'm like, and I've learned how to prop my leg up and down and do all the things. But even being in the living room is hard on a recliner,
yeah.
So it'll get better. I know it will. As I said, yes, huge win. I feel like the lights at the end of the tunnel, it's not a freight train anymore.
Good. Good. Well, we talk with a lot of people about the potential or the possibility or whatever of doing an update video. And I just keep thinking we want to do an update
Yeah, for sure.
video
I would
with
love it.
you for sure in, maybe in a year, to see, how things are and at what point you're at, cuz I know you're going to make progress too, and I know that it's going to get better. And unfortunately it might take longer, but then maybe not. I mean, maybe you're going to get to 4 or 6 months and all of a sudden a switch will flip, and things will just start moving along. And I mean, I felt the same way with me. I kept waiting to turn that corner. I never saw a corner, and I never saw a corner until I looked back, and then I would go, "Oh, okay. I have made progress." And
Mhm.
so I think for a lot of people, the only way to see how well you're doing and how far you've come, you have to look back and see where you were. And I think that that's probably going to be, very important for you. But again, I just so appreciative of you sharing your story, and being so positive and having such a great outlook, because I think it's important for people out there that might not have a great outcome, or maybe they're just having just an extra hard recovery or whatever, or they're having a normal recovery and it's really hard. And so it's nice to see that, somebody's having a really hard time and has a lot of other issues, but man, look at her smile and look at how happy she is, and how positive. So, your positivity can help other people, and me included, to just say, yeah, I can do this. I can get through this. So,
And the emotional piece has been really tough, and that was something to like consistency. I think I've heard on your videos with almost everyone has
yeah,
Yeah.
made
yeah,
mention of the I think that's the most consistent thing I've heard,
yeah.
because everybody's doctor does a surgery different. Everybody, the pre, the after, everybody's is the only thing consistent I really have heard is that the emotional. And as I said, I'm not one to cry and just losing it. And the apologies to my husband, which I have to shout out to the caregiver. And I love
Absolutely.
that you talk about that, Dee, because I asked him if he wanted to be on. He's like, "Mm." And it's funny, he's not a shy guy. He's like, no. um, he, as I said, he was part-time. The plan was part-time retirement. We knew this would be the good time to do it. He took off the first week. Then within 3 weeks, he wound up doing full retirement. And I don't like, he was kind of like ready, not ready to retire. And I think he was having a moment. And I just bursted out crying and said, honey, God did for us what we couldn't do for ourselves. Cause you wouldn't have just left. Like you just wouldn't have been like, no, you know what? I'm not gonna. Now maybe he'll work part-time down the road, something. He's 62, I'm 53. I can't, he's got a lot to keep him busy.
Well, it doesn't sound like to me that your husband is really retired. It sounds like he just went from
I
one
know.
At a
occupation
different job.
to another
Yeah.
job because
I know. So today I was like, well, maybe after this, the puppy will be ready for a nap and you can go out on the Harley for a little bit.
There you go.
And that's the advantage of living in South Georgia.
Yeah.
It's gorgeous here right now.
Awesome.
This time of year from now to about February is just beautiful. And I know it's probably a question you would ask anywhere. Anyway, for advice for others is
Yes.
asking people for help. Like really, I have a very tight community of people. And one of my close friends I reached out to and said, all I want is a salad. I don't
Oh.
want it a bag salad. I want like a salad that like you tear up the lettuce and you cut, you know what I'm saying? You cut an onion and
Right.
and she brought over this huge salad because the guys, my husband and my father-in-law, they could care less about vegetables,
Yeah. Yeah.
and I'm like, I just want fresh vegetables. And then we have a friend who owns a restaurant and she's like, tell Mike to come by. He can pick up a bunch of vegetables for a vegetable plate for you. But
Yeah.
asking for help and being out of your comfort zone that you can't do this alone. I don't know how people do this alone. I have
Mm.
I have no idea how you hear the people. I have someone come from a week or 2
Yeah.
weeks and I'm back to work. Oh my gosh.
Yeah.
I don't know how they do it.
Yeah. They're amazing. They're
Superstars.
they're not me, that's for sure.
Yeah, me neither.
So, all right. Well, we thank you again so much. It's been a joy to visit with you, and we really appreciate you sharing your story. And we wish you all the best,
Thank
and
you.
wish for you a full recovery, and that you will be able to find comfort and relief from your pain, and be able to go on and at least have this knee out of the mix. Well, thank you so
Thank
much,
you.
Christine. We really, really appreciate you.
All right. Appreciate y'all. Thank you so much.
All right. You have a happy
Have a good
holiday
one.
season.
Oh, you too.
All right.
Bye-bye.
Bye-bye. Wow.
That's
That was a different
That's a different-
experience than we've heard.
yeah, for sure.
Yeah.
To not even know that I mean, more pain from everything else, and then at 7 weeks, you're like, oh, I had knee replacement surgery.
Yeah. I mean, the allergy to the adhesives, and I didn't ask her, but well, glue is an adhesive.
It's true.
So I mean, just gluing it together, even if they didn't put any stuff on the outside, you know, I mean, how much of it came from that? Oh my God! But the pictures tell it all, you know. So, but her whole attitude, her positivity, her everything. I mean, and I get it, you know. It's like I'm doing this interview and I want to, you know, get the story out there, and like she said, yeah, she'll probably just do nothing for the rest of the weekend, but
I might do that too.
yeah, right. But still, you know, I mean, I didn't have complications, you know.
Yeah.
I think I had what I consider to be a typical knee replacement recovery. And, you know, and I'm still doing it, you know, almost 10 months later, I'm still recovering and I still have issues. Just like last night, I was telling you, my knee,
your knee hurt
my
yesterday.
knee is hurting. My kneecap is bothering me. And it freaks me out because I haven't been having any problems. And then I think there are so many people out there that just have so much that they're dealing with, and my heart goes out to them. And I mean, Christine is one of them. And so I'm just so glad that she shared. And so I just want to say to all of you watching, if you have any of these same issues or similar issues or whatever than what Christine is dealing with, or if you know someone that does, you know, let us know in the comments. Christine's going to be reading these comments, and she even said that she's willing to give her email address out and she'll talk to you. I just know there's other people out there who go through total knee replacement and deal with other things that make it even more difficult, and we want to hear from you. You know, it just in the comments even. Let's get you in touch with Christine, because you know there's strength in numbers.
Agreed.
So,
and support helps. That's why
yeah, we rally around each other, and yeah,
reach out to the groups, reach out here.
So for Christine to find somebody that says, I have EDS,
yeah,
and I had knee replacement 8 years ago, and this is how I mean, my goodness, what an amazing thing that would be. So
yeah, and if you want to come on here and share your story, it doesn't have to be as dramatic as this. It doesn't even have to be I had a difficult time. It can be I'm one of those people who was out on the golf course 2 weeks later.
Yeah.
Best thing I ever did in my entire life. I wish I'd done it sooner.
We love hearing that, because we like knowing that can happen.
Whatever your story is, if you're willing to share it, reach out to us at hello@totalkneetalk.com, and we can make that happen, just like we made this happen. Right?
That's right.
And if you know somebody going through it, share these videos with them, refer them to Total Knee Talk. This community is really taken off, really helping people, and also if you're going through this, cut yourself some slack, give yourself some grace.
And remember that this is your recovery. It may be different than mine, may be different than Christine's. It's yours.
Let's talk knees, titanium knees. From hurting to healing, to taking the lead. Let's talk knees. So next time someone brings up knees, don't just nod, lean in with ease. There's a saga in those joints, a battle fought, a new way to move, a lesson taught. Full range in 6 months, that's the move. Let's talk knees, yeah. Knees.
Did that make any sense?